Hello, this is Eddie Garcia, Senior Vice President at Healthsperien, and this is For the Health of It. For the Health of It is a weekly podcast covering all things health policy, brought to you by Healthsperien, a nationally recognized health policy consulting firm focused on federal and state regulatory and legislative analysis, advocacy, and business strategy. On today's episode, we're joined by two veteran policy experts and thought leaders from two sides of the political spectrum, but who share the same goal. How do we prepare for a thriving America post-pandemic? We explore the need for expanded health coverage to meet new demand, and we dive into the long-term economic implications of the pandemic, how we avoid a recession, and the likely health system response to these pressures. Thanks for joining us. Up first, your weekly Healthsperien, a moment to reflect on the bigger picture.
I'm Tom Kasumpis, President and founder of Healthsperien. Preparing and responding to a pandemic, an event of low probability but high stakes, is a challenge that the great nations of the world share in equal measure. We're forced to grapple with the nature of the disease threat, its mechanism of action, and how to test and treat it in a time-sensitive way that mitigates its impact on our ability to thrive, all while ensuring our societies and economies continue to function. Given these challenges, a pandemic response invariably adapts and innovates, making the strategic use of resources and leveraging society's technology, scientific, industrial, and public health capabilities in new ways during and after the fog of war. As we move to the next phase of COVID-19 response and staged reopening of the economy, we will also re-enter a period of substantial change in the healthcare system, informed by the enormity of the experience and its disruptive effect on people's lives. While we expect many aspects of healthcare to change, underlying tensions will remain in terms of the role of government versus the private sector and how best to deliver quality and affordable healthcare to all Americans. From building the Panama Canal to being first in flight, putting a man on the moon, to creating the internet, to cracking the human genome, I believe American ingenuity and engineering will continue to prevail even now.
Now join Healthsperien policy experts and friends for Stay in the Know, a weekly policy segment on the top health policy issues we're facing this week.
Hi, this is Andrew McPherson, Managing Partner at Healthsperien here in Washington, D.C., and this is Stay in the Know. I had the great pleasure of catching up with an old friend of mine and somebody I have a tremendous amount of respect for just this past week, Dr. Elizabeth Fowler of the Commonwealth Fund. Elizabeth is the Executive Vice President for Programs at the Commonwealth Fund based in New York City, but prior to that, she's held just extraordinary positions in and out of government for the better part of 2 decades. Liz was the special assistant to President Obama on healthcare and economic policy at the National Economic Council. She had multiple positions before that at the senior positions at the U.S. Department of Health and Human Services, where she assisted with implementation of the Affordable Care Act. I got to know Liz when she was the chief health counsel to former Senate Finance Committee Chairman, Senator Max Baucus, during the development of the Affordable Care Act. So Liz Fowler, welcome to For the Health of It in our Stay in the Know portion of our podcast. It's great to see you again and be reconnected. How are you?
Good, doing well. Thinking about everyone who isn't doing well and all of the challenges that we're going through as a country, but personally doing fine.
Yeah, it's such an extraordinary time. And I was rereading your bio and all the extraordinary work that you've done in the most senior levels of government, and just thrilled to talk with you today about not just the short-term impacts of the coronavirus pandemic, but really looking at the longer-term issues that we're going to face as a country, which I don't think are getting enough attention just yet. And you were a central player, Liz, in the development and implementation of the Affordable Care Act and continue to be at the Commonwealth Fund, and you were instrumental in the development of proposals to improve public programs during your time in government. How do you see coverage protections and issues related to access under the ACA working as we move past the emergency for the longer term?
So I think some good and some bad. Well, I guess I should start by saying thanks for having me. I really appreciate it. So some good and some bad. So first of all, on the positive side, thankfully we have the ACA that can be a backstop and can be a safety net for people that might be losing coverage, might be losing a job. Many of the states who run their own health exchanges have opened up a special enrollment period to give health coverage for people who might not have signed up, but now are worried about potential need of healthcare. And so I think ACA has played a really important role and really showed us why universal coverage is important. The downside is that there's still so many gaps. There's a lot of gaps. If you live in a state that didn't expand Medicaid, if you live in a state that's relying on healthcare.gov, which is the federal exchange, and HHS has said they won't open that up for people to enroll in health coverage. So it's also sort of a confusing landscape on where to go and what your options are if you don't have coverage and you're worried about it. I know there have been announcements by the federal government and by health plans that they're going to cover testing. They're going to cover, many of them, the cost of treatment. Part of the stimulus funding from the administration to hospitals says that they'll help cover the cost of uncompensated care. But it's really a very confusing landscape if you don't know the health system. And so I think that's probably the downside. So the downside is that we see how much more work we have to do to come up to so we really have a national healthcare system. Going forward, and this is what we're spending a lot of time on at the Commonwealth Fund, is really trying to think about what is going to be the public's appetite for looking back on this experience and trying to chart a path forward. Is there going to be this groundswell of support for trying to fill those gaps? Or do we go back to sort of slide back to the status quo? We're not sure yet. I think the story of the pandemic is still being written. The pandemic of how it's affecting people's jobs and families and health coverage is still being written. And so we're trying to understand it as we go along, but I don't know that there's a consensus on a path forward at this point.
Yeah, I want to dig a little bit deeper on that question of gaps and the question of quality coverage, thinking about the longer term impacts of the coronavirus. And we just saw last week, for example, that some of the progressive Democrats introduced legislation to allow for individuals who lost coverage as a result of the pandemic or of losing employment, that they could have access to Medicare. What does this mean long term for the Medicare for All discussion, do you think?
Well, I think it's, as I said, the landscape is for health coverage in the country is so confusing. So I could see one scenario, if job loss, if coverage loss, if this pandemic goes on through the rest of the year or gets worse, that there is a groundswell for, a simpler solution towards health coverage. And people really stop and say, is this the best way to organize a health system? Mm-hmm. But we're a pretty diverse country. We don't have consensus now. 18 states are still challenging the ACA. That case is going to go to the Supreme Court this fall. And I think what those 18 states would say is that we should repeal the entire act and not just the offending provisions. So I find it hard to believe that we come out of this as a nation with consensus where we didn't have it going in. But I'd love to be wrong and we come out with a renewed sense of community and ability to come together and solve big problems. But my experience at the ACA and the 10 years since question whether that is a valid conclusion.
Sure. And I mean, not to mention the budget outlook, right? Which is, in a word, looking ominous, even more ominous than it was prior to the pandemic. Talk a little bit about post-COVID, once we are able as a country to better manage and hopefully we have a vaccine for the coronavirus. What does the budget outlook look like? I mean, and how do we think about the budget and controlling healthcare costs over the long term?
It's a good question. And we actually have a roundtable coming up on Wednesday with a lot of economists and thinkers about what the potential implications are longer term for the economy and specifically for health spending. I think there's a number of intertwining threads there in terms of what we're seeing and what that means for providers and their financial capacity. For Medicare, if you were watching closely, the Medicare trustees report says that we're at 2026 for solvency. So Medicare solvency is right on the horizon. And the trustees said that this does not include COVID. So it doesn't factor in either the additional spending or the loss of revenue from the job losses. So I think that could be a very mixed picture. I think for health spending, we may be close to even if not slightly reduced for the year because of all the cancellations and delayed care that's not being provided in hospitals and clinics around the country. I think that also has very significant implications for the financial well-being of our healthcare system generally. And I think there's a lot of people that are very worried about that, and particularly when it comes to primary care practices and what that means for primary care. Like I said, I think the story is still being written on this as well. I will say we have spent time talking to health plan actuaries, to employer benefit consultants, to American Academy of Actuaries. We've talked to providers. We've been talking to teaching hospitals and for-profit chains and community hospitals about what all of this has meant for their bottom line and their ability to go forward. And it's going to take the health system a while to recover from this pandemic. No question about it.
And something that we keep thinking about is, and I think you touched on, Liz, is value-based care. And do you see the pandemic and the resulting impact of the pandemic from a cost perspective as an opportunity for the future of value-based care and the movement to value-based care, or is it an impediment?
So I think the answer to that question is mixed. First of all, let's separate out telehealth, which seems to have grown by 500-fold in the last 2 months. And we've seen CMS relaxing a lot of the rules that were a barrier previously to accessing and getting telehealth paid for. So I think a lot of those changes, and we'll see, separating out some of the regulatory changes that CMS has made in the face of the pandemic, which ones of them should continue, which ones of them go back into place once this is over. But I think the ability to access healthcare virtually is here to stay, and I don't know that anyone is going to argue with that. In terms of value-based care and payment arrangements, in terms of alternative payment arrangements, I think the story is a little bit more mixed. So in our conversations with providers, whether they have the capital, if they weren't already engaged in exploring alternative payment arrangements, whether they have the capital or the ability to take on risk or invest in new approaches, which might include the need for capital to invest in new IT solutions. That, I think, is a legitimate question. I'm not sure that for some, they'll have that ability to jump into that space. On the other hand, there might be more openness to thinking about solutions other than fee-for-service. We're completely dependent on a fee-for-service environment right now, and when fee-for-service doesn't happen, the whole system is at risk. And I think there are some very legitimate questions to ask, whether or not we want to continue that system or whether we want to think about alternative approaches. The Commonwealth Fund has an international angle as well. We talk a lot with providers and governments in other countries. And for some, and maybe this gets back to the Medicare for All question you raised, for some countries, like the UK, for example, the NHS primary care is not dependent on fee-for-service. They're not dependent on people coming in where they do tests and procedures and then providers get paid. I'm not sure we could ever jump to that sort of arrangement, but I think it is asking legitimate questions of, do we need to think about our primary care infrastructure and our health system infrastructure differently in terms of what we need to keep it going when fee-for-service collapses in the way it has over the last couple of months.
And speaking of the healthcare infrastructure, I want to turn to long-term care for a moment. We're seeing that long-term care facilities have proved to be a major hot zone for the spread of COVID-19 and raised just a number of concerns about, frankly, how we take care of our seniors in this country. What steps do you see being taken short and long-term to better protect seniors and those with LTSS needs in the United States as a result of the pandemic? And what do you think it means for the future of renewed focus on home and community-based services?
I think that's a really good question. And I think those are questions we need to be asking. I think Medicare's ability to drive and control nursing home quality is relatively weak. Medicare doesn't cover a lot of long-term care, only skilled nursing care. The quality and infection control is sorely lacking. And I think that's been maybe the second biggest story coming out of the pandemic. Well, maybe it's the first and telehealth is the second, but they're right up there together.
And what do you think Congress should be doing today, Liz, to mitigate these long-term risks? I mean, we've seen the Congress on a bipartisan basis spend about $4 trillion. I think back to the Affordable Care Act days, and then you were right in the center of that. It feels like the Affordable Care Act just happened in a matter of weeks rather than the 2 years that
Right.
You all spent developing the legislation. What should Congress be doing today from your perspective? What are the top 3 priorities looking forward to mitigate some of these longer term risks from your perspective?
Well, certainly hospitals have put a lot of effort into pandemic preparation and control. And the more we talk to hospitals, the more we sort of learn about these plans. Some are in varying states compared to others. Some have done a better job of that planning than others, but we don't ask the same thing for nursing homes, or at least not to the same degree or the same standard. And I think that's one area we really need to revisit. And I think there's a role for Congress there. In terms of other jobs for Congress, they need to think about our healthcare infrastructure and providers in particular. They put a lot of money into propping up the hospital systems and our facilities, but I think we need to do the same thing when it comes to healthcare practices and particularly, as I mentioned, to primary care. And just for point of reference, how much has Congress put into hospitals? It's over $150 billion so far. What Medicare spends on hospital coverage or inpatient hospital care in a year is $175 billion. So we're putting a lot towards making sure that that infrastructure stays sound. I think the details of who gets what and how the money is distributed is an ongoing conversation, but we need to do the same thing for primary care offices and physician offices. So that's one thing Congress can do. And then I think also we need to be asking about coverage. In our surveys, and if you compare this economic downturn to 2008, and 2008 was banking and Wall Street and a lot of jobs that were lost of people that had health coverage.
Sure.
I think this economic downturn, if you look at who's losing their jobs, it's a lot of the hospitality industry, restaurants, hotel workers, tourism, gig workers, the gig economy, a lot of people who might not have had coverage going into the pandemic and going into the economic downturn. And we're seeing that bear out in our surveys. But as the economic downturn continues, I think it's going to start eating into healthcare coverage for people that may have had coverage already. And we're in a different landscape, harkening back to what we talked about when we started this conversation. ACA has provided an important safety net, but there are some very important gaps in that. And I think Congress needs to really spend some time understanding the coverage gaps and what can be done in the future to plug those holes. I think it also does start to raise the question, depending on how long this goes on, of employer-based coverage and whether or not health coverage should be so closely tied to your employer that when you lose your job, you also lose health coverage. And I think that question I have heard in many conversations that we've been having.
Liz Fowler, Executive Vice President for Programs at the Commonwealth Fund, thank you so much for joining us today. This was terrific.
Thanks for having me. And it's nice to reconnect, and good luck for all of us weathering this storm.
Thank you. And now we turn to Doug Holtz-Eakin, who is the president of the American Action Forum here in Washington, D.C., and was a former director of the Congressional Budget Office. And joining me for the interview with Doug is my colleague and senior partner at Healthsperien, Jean Dessaw.
We're really interested, Doug, in exploring today the long-run impact of the pandemic on the U.S. budget and on the healthcare sector broadly. We're looking at questions of sort of the potential long-run changes in the coverage landscape, provider financial health, but more importantly, and one of the reasons we really wanted to talk to you about what happens to the healthcare system when the proverbial tab comes due for all the near-term relief that's been sent out the door for individuals, businesses, providers, states. We wanted to get started. For you, former CBO director, what trends do you see for the budget outlook as we move forward from this risky period into a further risky transitional period toward what we hope is an economic recovery?
Well, first of all, I just want to note for the record that when I was the CBO director, Jean Dessaw launched my career, and I want to thank her for that. So it's nice to get back and have this conversation with you.
Well, thank you, Doug.
My take on this is that we're at about $3 trillion for the annual deficit. We'll probably get to 4 before Congress is done for the year. For those who can remember, as far back as 3 months ago, we came into the pandemic with a really pressing fiscal problem. That fiscal problem was that spending exceeded revenues as far as the eye could see. The deficit was going to average about 5% of GDP. It's not going to be much, much more. The ratio of debt to GDP was spiraling ever northward. And a minimal condition for a country is to be able to stabilize its debt relative to its national income, GDP. And we were nowhere close to that minimal condition. I've been amused by people who say we don't have a problem because there's no catastrophe, no Portugal, Greece style meltdown. But getting a D is not doing great. It just means you haven't flunked entirely. And we're getting a D. Now we've had the pandemic. It's going to be much, much worse. Somewhere, 2023, 4, 5, the realization is going to come that it is absolutely imperative to begin bringing down the annual deficit, bringing down the ratio of debt to GDP. And that's going to require combinations of very rapid economic growth, which the right always loves as the way to get out of any problem, higher revenue, which the left always finds as the solution to every problem, and reduced entitlement spending, especially healthcare programs, which neither side has any interest in doing and has avoided for years now. So that's coming. And that's going to be, as a policy matter, difficult. It's going to be challenging to do. And as a political matter, it's going to be very unpleasant. And so this is bad. This is historically bad. And you'd like to think after an historically bad episode, you'd get a little time off and a pat on the back. But I'm afraid that's probably not our fate. It's going to be a lot of hard work.
I mean, I thank you for that very positive but very frank outlook.
Everybody loves having me.
Right, exactly. But, and I think there's questions about, you said 2023, 4, 5. So this is going to start to hit us soon, the decisions that will put policies in place to, for example, deal with entitlement spending. How do you see the health system changing in response to that? I mean, certainly you rob banks where the money is. And so we're really looking at changes to Medicare, to Medicaid, even as we have a long-term care crisis that's about to come at us as well. So how do you see the system changing? What does our health system look like on the other side of this?
I don't know, to be honest, but you can see a couple of things where there's going to be a lot of pressure on it. First and foremost, everyone's going to rethink the idea of a nursing home and sort of how we do the care of the elderly. And it will probably generate something that I thought was desirable going back, decade now, which is we're going to deliver in the home a multitude of services that will be labeled either long-term care services or health services. The distinction is going to become less and less important. And there'll have to be a much more flexible delivery system that relies a lot on the technological advances that have served us so well in this crisis. So you can see that coming. And I think bringing things to people is going to replace getting people to facilities. The second reason I think that's likely the case is that I think what we've learned in this crisis is our healthcare system cannot walk and chew gum at the same time. It is not nimble. It is not flexible. We have to shut down surgeries because of the crisis. We can't do two things at the same time. That's increasingly problematic. And I think you see a lot of pressure on a much more dispersed, flexible delivery system that takes advantage of many different kinds of providers. That's going to come, I think. That's also probably cheaper. It generates better competition. And that's something the health sector has tried really hard to avoid. I think that will take a little bit of time, to be honest, because bluntly, if you look in the data right now, the money is in hospitals and docs, and the hospitals have the docs. And anybody who's thinking about policy design focuses on that because that's where the money is, as you said. They're going to be politically bulletproof for a little while after this pandemic. And there's not a chance you're going to get a reform through in the near term that sort of takes on the existing structure. So it's going to take a little while for that to gain any kind of momentum. The other thing that I can see is that we're going to relabel maybe a sort of social determinants of health debate and the lines between public health and private health. And we're going to start paying a lot of attention to big data, the existence of potential threats on the population, and be much more prepared on that front. And that will, I think, lead to some real rethinking by the plans and the employers about how do you think about pricing comorbidities? Because what we've learned is it's not just the care of them, it's what they expose those people to. That's one of the real takeaways from this. So they're going to rethink what's really my risks in this environment. And if you can have good surveillance for broad population risks, you might feel a little more secure on that front. I can see a bunch of those things happening.
Well, it's interesting. I want to pick up on the last thing that you mentioned about health plans and the employer-based system reimagining its role in or getting more involved incrementally in different aspects of health. Do you see they're the main framework of our private healthcare system? Do you see them sort of coming out of this stronger, but with a different role, or how do you see the role of employers and plans in the market of the future?
I think we learned from the ACA decade-long debate and the pandemic that people like their employer-sponsored health insurance. They do. And it is not going to be easy or perhaps even feasible to move away from it as the bulk of coverage in the United States. And so if you think of the employers, they now have to reimagine where they are, right? We have a sort of different world, and what should they do? They had already begun, I think, to do probably some of the most interesting work on plan design and how do you get value and work hard to deal with quality metrics. They'll be at the center of that. And now they're going to have a new issue, right? Right after the reopening at whatever pace happens, as an employer, I and you and everyone else is going to have to figure out a way to get their employees in the building and have them be willing to show up. And that's going to mean some physical alterations. I have spent my pandemic pushing carols around my office so that they're now 6 feet apart. And it may require regular testing as part of the workplace environment. And thinking about what we're going to cover in the plan. Are we going to cover testing as an employer-provided benefit to the employer? Or is that going to be an employee discretionary medical choice? How is that going to play out? I think the testing environment is going to be an important one going forward. So employers are going to be thinking about, all right, what dimensions am I operating in now that I didn't used to have to? And I think they will be the best source of cost containment in the near term. It's much harder, as you know, to deal with the large public programs, the sort of Medicare's, Medicaid's, Affordable Care Acts of the world, because of the just core politics of getting it through Congress.
So with respect to Medicare and Medicaid, Doug, and thinking about how much progress we've made as a country toward value-based care and value-based models of care. Mm-hmm. How do you see that playing out as a result of the pandemic? Do you see an acceleration of value-based care, or do you see major changes as we move toward a more value-based approach?
Well, I think we've had this sort of ongoing need to get more for our healthcare dollar, and everyone in the system has felt it. Realistically, we have about a year or two of pressure comes off on that. The hospitals are going to just try to recover, and a lot of the providers are going to just try to recover, and the Congress is not going to be eager to use federal programs as a driver of reform in that environment. I don't think that's particularly likely. I think it'll take a little bit longer term. One of the things that might happen, I could easily see the Trump administration doing this, and I don't know if they would survive it, but I could see them deregulating a lot of things as they have in the crisis. They've had emergency waivers of all sorts of things. They might make them permanent and open up, I think, a little more flexibility and competitive pressures on them. That would be good over the long term. It just doesn't generate savings very quickly.
Doug, sort of getting back to this, as we used to say at CBO, there's a range of possible outcomes for the transition we're in terms of getting to what is the other side of this, getting back to people move from a no coverage environment back to their employers or employer-based coverage. There's going to be something on the other side of this. And it's a question of how long does it take and to what percent do we get back? What can Congress and the administration, other policymakers in the states do now to moderate the long-term risks that you were talking about before to the country's financial outlook and to the healthcare system?
I think the threshold question is, what are they going to do for what are probably 20 million newly uninsured individuals? There's been remarkably little discussion, I think, of the fate of these 30 million individuals who have applied for unemployment insurance over the past 6 weeks. Almost certainly, many will be uninsured in the near term. If they are left uninsured for a prolonged period of time due to protracted political struggle or whatever it might be, something that, quite frankly, given how poorly we as a country have handled this problem over recent years, that's a possibility. I think that really pushes things toward, we're going to cover everybody in a federal program. And that gets us back into the beginning of the ACA debate all over again. And that's just lost ground. On the other hand, they may pay their COBRA or something like that in a way that quickly covers them, preserves the existing arrangements, and puts that, what I view as a big mistake, sort of, to go off and have a big coverage fight and get back to the core of how's the system going to work. And so that's the thing I'm most focused on. Beyond that, I honestly think the number one thing that any leader can do right now is public education. So it is my belief that the vast majority of Americans are unaware we have a federal budget problem. For 8 years, President Obama sent the message that there's nothing wrong with the federal budget that can't be fixed by taxing rich people. President Trump has never said a word about it. So you've had nearly 12 years of leadership that does not say anything like, look, we have a big dollar problem. It involves the social safety net that you consider so important and many of you rely on, and we're going to have to make sensible changes to it. Don't be afraid. We care about you. Have that conversation. But they haven't had it. And so if you now start to tinker with the entitlements in any way, they'll think it's out of maliciousness or whatever, pure politics. I don't think you can make those changes in that environment. So there has to be a real honest discussion of where we are. And it hasn't happened yet. The corresponding discussion on the right has to be, we need more revenue. I'm sorry. I know you hate raising taxes, so let's try to raise it in the least damaging way possible. But there is no way that we reach bipartisan consensus on fixing this big problem without touching the revenues. There is no way I can see that happen. So that's less pulling the levers than providing leadership, education, and getting people ready for pulling the levers themselves.
Thank you, Doug. That makes a lot of sense. And, you're right. The budget analysts haven't been getting the attention they deserve in the last few years.
I 1,000% agree with that.
I want to thank you for coming today. This has been really terrific and a really big wake-up call. As we talk at Healthsperien about changes to the health system, we think a lot about some of the issues you were talking about related to prospects for care in the home, how it might not be policymakers and fiddling around in Washington, but it might be the developments and advancements in technology, telemedicine, big data that are going to really change the frontier for us. Do you have any other thoughts on that before we sort of close out this podcast?
I think one of the good things that happened in a weird way for the health system is the president left it to the governors. And so we did decentralize the response to the crisis to a great degree. We need more of that. We need more grassroots disruptive change in health and less sort of planned change done out of CMS, because in the end, that never turns out to be change.
Doug, thank you very much. We really appreciated having you today and hope to bring you back at some point soon. And thank you again very much.
I'd be happy to. Thanks.
For our last segment, here is our outlook for the week ahead.
My name is Melissa McHale. I am a health policy analyst at Healthsperien, and I'm going to give a recap of what we're going to expect coming ahead this week. So the House of Representatives is going to be back in session after being in their home districts for the past couple of weeks right now, and they're reconvening to start building on the fourth phase of economic relief legislation. Speaker Nancy Pelosi confirmed the House could vote on this version of the new coronavirus relief bill sometime this week, which is going to aim to dig deeper in terms of addressing the needs that institutions as well as individuals are going to need in light of this pandemic. The Democratic bill will contain three major parts. It's going to focus on relief for state and local governments, funding for more testing, and other needs for reopening the economy, as well as, quote unquote, putting money back in the pockets of the American people, which we would likely see through extended unemployment insurance benefits and providing more stimulus payments to individuals, as we're seeing record numbers of unemployment. To add to that, Democrats are discussing amongst themselves how to deliberate these proposals. For this next round of aid, they're focusing on whether to pass a Democrat-only measure before starting talks with Republicans in the Senate and the White House. And some moderates are showing an openness to Republican ideas, such as tax breaks and liability protection for businesses. Speaker Pelosi has indicated that the next relief package that the House Democrats are working on will be a starting point for negotiations with Republicans. And their support among the Republican side will be needed to get this bill to President Trump. But Speaker Pelosi has been very candid that while she's willing to negotiate with them, quote unquote, don't draw lines in the sand, we are not, which is basically saying Democrats are trying to put this front that like they're working for what's best to get the country going as people are really struggling to stay afloat economically, as well as like their actual literal health is in danger here. So they're trying to put a front here that like they're building relief for institutions such as hospitals and state and local governments, as well as individual Americans. And they're trying to kind of quash this partisan back and forth that's been going on for the past few weeks. Republicans, however, have been very broadly skeptical of these provisions that Democrats have been kind of talking about expanding on. They're especially skeptical of providing funds to state and local governments, at least not to the extent that Speaker Pelosi has stated, which she's confirmed that $1 trillion might be necessary to allocate to state and local governments, not right away in this package, But over time, as states begin to recover from the revenue they've lost in the coming months, and as they are trying to deal with reopening their local economies while also keeping Americans safe and enforcing social distancing. But some Republicans have been iterating Mitch McConnell's position that providing relief to state and local governments that are losing revenue is a bailout for Democratic states, such as New York, California, and Illinois. To further confirm that, House Minority Leader Kevin McCarthy has told reporters action on another bill should await hearings and other evaluations of how prior funds from the CARES Act and the Families First Coronavirus Act are allocated and being used. So Republicans are trying to kind of heed their time from really making any solid promises for additional relief. And while Democrats are focusing on kind of building on what has been established within the past pieces of legislation and allocating funding as needed to individuals and institutions. And that's everything you need to know about what's going on in Congress this week.
That concludes our episode for this week. Thank you for tuning in. If you have any questions on anything you heard on this week's episode, please head over to Healthsperien.com for more information and deeper analysis. And as always, tune in next week for more health policy insights and discussion.